Right. Good evening, everyone, and welcome to the Adult Social Care and Public Health Committee. And welcome to members who are here and to any members of the public listening at home. Just need to remind all of you to turn off your cameras and your microphones until you're actually speaking. You're invited to speak. So we will, hopefully we're all working. Is everything working properly? Oh, that's good. That's excellent. So, yeah, it is important as well. Just before we do a roll call, to remind you all that this meeting is being webcast and that a record will be retained on the council website. And for those of you who are at home and you are looking on a webcast, if you look above the video, you'll see a resources tab. And if you select that, and a link to the agenda will appear on the right-hand side. And this will allow you to open the agenda in PDF forms, and then you can, that will obviously help you to follow the discussion and the debate, and you can read our riveting reports and have a clearer picture of what we're discussing. So if I could ask the Borough Solicitor to please do a roll call so we know who's here.
Of course, Chair. Good evening, members. Is Councillor Berry present?
Yes, I'm present.
Councillor Burgess-Joyce?
Yes, good evening, Vicky.
Councillor Collins?
Yes, present, Vicky.
Councillor Cottier?
Yes, good evening, present.
Councillor Frost?
Hi, good evening, present.
Councillor Gilchrist?
Yes, good evening, present, thank you.
Councillor Cannon?
Councillor Cannon, present, thank you.
Councillor Jordan?
Councillor Jordan, present, thanks.
Councillor McLaughlin?
Oh, Councillor McLaughlin, present.
Councillor Usher?
Evening all, Councillor Usher, present.
And Councillor Nolan is, of course, our Chair and has already spoken. Thank you, Chair. I think everybody's present.
Right. Excellent. Thank you. Yes, had no apologies for absence. And the committee probably are aware that Councillor Cannon is deputising for Councillor Sharon Jones for the foreseeable future. Right. Do we have any declarations of interest from members?
Yes, Chair.
Yeah. Councillor Collins, yes.
Thanks, Chair. Yeah, just need to declare that I'm a governor of the Wirral University Teaching Hospital, and my daughter works for them as well.
Okay. Councillor Jordan.
Thanks, Chair. I work for the NHS. My son works for the NHS. I'm a trustee of Inky Babies.
Okay, thank you. Councillor Usher.
Thank you, Chair. Just like to declare an interest by virtue of my employment of Autism Together, one of our care providers here.
Okay, so that will be a pecuniary interest, Councillor Usher, I think, in a particular item on the agenda, won't it? I think that may require you to leave the meeting. So we'll deal with that towards the end. Councillor McLaughlin.
Yes, thank you. Got a daughter works for the NHS.
Okay, thank you. Right, we have no other declarations of interest. As far as I'm aware, we have no public questions, not been notified, have we?
No, Chair, we've not been notified of any public questions. No members of the public wishing to make a statement. You might just want to check whether there's any members who wish to submit any petitions.
Yes. Are there any petitions any members have? No? Okay. So no, we don't have any tonight. That takes us to item 4 on the agenda, which is for our Director of Public Health, for Julie Webster, about her public health commissioning intentions. So I'll hand over to you, Julie. Oh, no, well, if you're not on mute. Now, I know that Julie's system is working because I spoke to her only 10 minutes ago on it. Right, well, while we're waiting for Julie,
While we're
let's
waiting,
just check that while we're waiting for Julie, let's just check on the minutes of the last meeting. Has everyone seen them and has everyone agreed that they are a true record of last month's meeting? Is that agreed? Thank you, Councillor McLaughlin. Thank you, Councillor Cannon. Right, Julie, has Julie arrived yet?
Hello, Councillor. Yes, can you hear me now?
Yes, I can hear you now.
Oh, thank goodness for that.
I know you were actually here because I could see your little circle with your initials on it. It was just we couldn't actually see you or hear you.
Okay.
Okay, so
Thank you.
yeah, your paper item 4, Julie.
Yeah, thank you. So the paper in front of you, councillors, is the paper outlining the Public Health Commissioning intentions for 2021-22. And the aim of the report is to seek agreement from yourselves to progress the commissioning intentions. I'll just go through them briefly with you. Public health is funded through a ring-fence grant. The majority of the public health grant is actually spent on commission services. We do not do direct delivery from the public health team. And the paper details how the grant, which for this year was just under £30 million, is spent. And you can see at 3.4, it mentions there that 65% of our grant is spent on commission services, 24% on council services such as environmental health, 6% on running costs, including the Wirral Intelligence Service, and we do keep a reserve because we have been subject to a year-on-year grant reduction, but of course we do have commitments through our commissioned intentions, so we believe it's prudent to have those reserves to ensure that we can meet the commitments that we've made through our contracts. So in the paper, you can see that our service is delivered by a range of providers, and we currently directly manage 30 contracts with 26 providers. So in 3.9, it details there the ask of the committee, which is for 6 contracts that are ending this year to be retendered, 5 to be evaluated and reviewed, 6 to be extended for 1 year, and 13 to continue with no changes. The contracts that we're asking to be retendered are those relating to the Stop Smoking Service, the BAME Health Improvement Programme, and there are 4 children's services which this committee isn't being asked to comment on because they're going to the Children's Committee at the beginning of December, but for completeness have been included in this paper. We're wanting to, if again in the paper, if you can note that the proposal to recommission the BAME Black Asian Minority Ethnic Health Improvement Programme is going to be done jointly with Wirral CCG and will draw upon lessons learned during the COVID-19 pandemic. The Children's Services Recommission is to be done on a short-term basis, but that's to enable us to align our contracts with children and young people services and to very much focus on the prevention agenda. And then from 3.17 onwards, there's commentary there about the contracts that are ending in March next year, and we're asking to extend them for a further year. And then from 3.20, there we talk about the 5 contracts that we want to evaluate and review and come back to you with proposals for sign-off with regard to the future of those contracts. And you've got in Appendix 1 the full details of all the contracts, the providers, contract period, and the value for detail for you. So it's a very brief run through, Chair, and then the recommendations are as per the first page.
Yeah. So when are you expecting to come back? Will you bring back all of those in March? You know, we've discussed March for some of them.
So we need to know, we won't come back in March. It'll be this time next year, really, when I'm coming back. So at the moment, I'm just asking for permission from you to go out to retender the stop smoking contract, the BAME contract, and we will discuss the 4 children's contracts at the Children's Committee in December.
Right. Any questions from members? Councillor Gilchrist.
Thank you, Chair. I just want to make sure I understand, because you were asking about when we'd be looking at them again. A lot of the contracts run from October 21 or September 21 onwards, so we need to have a clear view in advance of that as to how things are going, I think. The underlying thing that troubled me last year, round about January, February last year, I was getting increasingly anxious because we didn't know the value of the public health grant at that time, and my recollection is we didn't know the public health grant until early in the spring. The paperwork we have suggests that we will know the public health grant soon. Perhaps it's coming as part of this year's settlement, but last year I was very frustrated, and I think officers were, about not knowing till pretty well the last minute. I do hope we're not in the same situation this year. Thank you, Chair.
Anyone else? Questions or comments on the contracts? Councillor Cottier.
Thank you, Chair. Yeah, obviously it's a strange times again, but just so we can have a bit more of a broader understanding of what's going on, can I ask for a bit more of a detailed report on the outcomes from the drug and alcohol service, as it's such a quite a big chunk of the budget? I'd like to have more of an understanding about the outcomes from such a big investment, if that's okay. Is that possible, Julie?
No, absolutely, Councillor. We have previously done a yearly report to the committee, so we'll absolutely schedule that in for the new year and bring that. And I think at the moment we would aim to bring it in March, so that we've got a full year's data that we can report to you.
Thank you.
Is that all right, Councillor Cottier? Does that answer your question?
Yes, thank you very quickly. Cheers.
Anybody else? Any questions or comments? Right. In which case then...
Darling, have you got Daisy?
Hello? Councillor Cannon, is that you?
I'm so sorry, I pressed the wrong button.
Councillor Cottier, have you still got your hand up, or is that a legacy hand? A legacy hand, clearly. Right, so somebody want to move the recommendations? Got a mover and a seconder for the recommendations?
So moved, Chair.
Thank you. Seconder?
I'll second if...
Thank you, Councillor McLaughlin. That's fine, so that's done. Oh gosh, it's you again, Julie.
Yes, I'm afraid you can hear a lot of...
It's going through the Julie Webster show tonight.
Yeah, I'm afraid so. Apologies for that.
Item 5, the rollout of lateral flow testing in Wirral.
Yeah. So thank you, Chair. You've got a paper in front of you that, as you say, outlines the proposal for the rollout of lateral flow tests in the borough. There are a number of testing modalities now for COVID-19. Lateral flow tests are the tests that are particularly being used in Liverpool at the moment. So this is where you can get a test within 30 minutes based in the community. As it says in the paper, they are simple to use, point of care testing, and gives us rapid turnaround because they don't need to go to the lab for processing. As part of the Tier 3 agreement with Liverpool City Region, we have been offered the opportunity to direct and deliver community-based testing, and this paper outlines how we're proposing to use lateral flow tests locally. basically to help identify and isolate those people who've got the infection more quickly, because this is very much focused on people that haven't got symptoms. We've still got a wide offer for people with symptoms, and I would encourage anybody with symptoms to go to one of those local testing sites that we've got in the borough, which we've got 4 now, which are spread out across Wirral. And it's also, obviously, if you get the test done quickly and you get that result, it means that you're able to self-isolate more timely, in a more timely manner. The paper outlines how we'd like to use the lateral flow tests. We're being offered a significant number of tests, 10,000 in the first instance, and then the capacity to test up to 10% of our local population weekly. Our proposal in the paper is to focus on targeted populations at high risk, and we're particularly wanting to run a number of pilots across the borough based on the risk that people in the group become infected and the severity of the consequence of onward transmission if people in the group do become infected. So, for example, and in 3.4, we highlight the priority cohorts that we want to undertake lateral flow tests in Wirral, and they include frontline social care staff, including care homes, and we're proposing to pilot lateral flow tests to enable safe care home visiting. We also want to work with Wirral Hospice, YMCA, and the ARC and other hostels that are providing accommodation to vulnerable individuals. So there's a range of priority groups that we've got there, and we're aiming to start that work within the next 7 to 10 days. We are learning significantly from Liverpool and what they've done over the water, and they're very much, some of the early learning is make sure that you're very clear about why you're doing these tests, because whilst we've got the test, we haven't got the resources to actually go in and deliver the test. So we need to train up, for example, care home staff to be able to undertake the tests and to read the tests. And that's the same in the other venues that we've highlighted in this paper. So we need to work with our partners, to make sure that they feel comfortable and competent in doing the tests and are connected into the National Test and Trace programme. This is an opportunity to roll out this technology, but we need to do it, I believe, in a focused and very much a targeted way, so that we do focus on those populations at high risk. So, and I wonder, Chair, if at this point it's right to talk about the developments that have happened today.
Yes, I was just about to say, there's information that I received literally half an hour, I think, before we started the committee, and I think it's really important that the rest of you hear it as well. So, carry on, Julie.
Thank you. So, Paul Sator and myself were invited to a national meeting today with the Cabinet Office and the Department of Health and Social Care, together with other Liverpool City Region Chief Executives and Directors of Public Health. And there was a meeting then this afternoon with the Metro Mayor and Council leaders. So there's an offer from national governments around the rollout of mass asymptomatic testing into the borough. Now, that doesn't go contrary, I don't believe, to the paper I've just presented to you, because I think we need to continue to do the work that I've just outlined in the paper around getting those tests into our high-risk settings. And then alongside that, there's a piece of work to be done with LCR to understand how can we make best use of mass asymptomatic testing within the borough. And we need to develop the proposal around that. Again, at the moment, I don't believe, apart from the tests and an offer of some support around initial setup, there's no additional resources coming our way to deliver mass asymptomatic testing at scale. And you'll all be aware that obviously Liverpool have been supported by 2,000 soldiers over the past 14 days. So that's a big ask of the borough to do that with any additional resources. But what I am doing is working up, if we did do it locally, what would it look like, and what would the resource implications be? And obviously that would need to come back for discussion with yourselves.
Yeah.
But sorry, Councillor Nolan, and there is obviously, as happens with COVID, everything needs to be done at pace. So that needs to be done within the next week.
Yeah, I absolutely agree. I mean, we've discussed this targeted approach. I believe it's the right approach. I have serious concerns about mass testing and question A, its efficacy, and B, its purpose, really. And also, if this is coming, if we're being told that we need to do this with no additional resources or support, I'm very inclined to the view that says, well, that's lovely, thank you very much. However, it's not possible for us to do that. And I think we need to push back against that. But, obviously we'll take the views of the committee. That's my view. I'm really concerned about it. I really don't understand it, because I'm aware that when they did a sort of mass test across, I think it was across Worth, it was something like 0.15 of the staff, asymptomatic people, were actually positive. And you have to question for the amount of resources and the input it will take to identify 0.15% or something very low like that. Is that an effective use of resources? But let's have the discussion. Councillor Burgess-Joyce and then Councillor McLaughlin.
Yeah, thank you, Chair. Julie, I'm just looking at 3.4, and that's quite a large number of points there on that list. I just wonder if you know how many people that would be as a maximum off the top of your head.
I don't, Councillor, I'm afraid.
Right. The reason for asking the question is that I had a Zoom meeting with a ward resident last night, and it was over something else. It was to do with a social care issue that she wanted some support on. But she's Ghanaian and obviously quite concerned. And towards the end of the conversation, it did come up that that they were in that sort of priority group. I'm just conscious that you mentioned about 10,000. Would that touch that kind of figure? I think that's the question I'm asking. I'm putting you on the spot, but if it doesn't touch that figure, then 10,000 just isn't going to touch it, really, is it? And she was quite concerned, in fairness.
Okay. I mean, I think there is. I think we've got significant testing capacity now within the borough, so I'm not worried about the capacity that we've got. It's about, I suppose, managing the demand and making sure it's going to the right people. And if that, I don't know about that individual's case, obviously, but certainly I could suggest to you that if she made contact with WMO or Wirral Change, then she might be facilitated in getting a test.
Right. Okay. I will do with that particular individual, but obviously, there are other people who fall into that Black, Asian and minority group as well on the Wirral, which are susceptible. Absolutely.
And so we're trying to do a lot of work through the BAME groups and be very flexible in that approach. So, work closely with both those organisations I've just mentioned and other people that we've not worked with before. So we've been introduced to new groups.
Mm-hmm. All right. Thanks, Julie. Thank you. Thanks, Chair.
Thanks. Thank you for that, Julie. Yes, as I say, it's a huge issue, isn't it? Because after all, what does it tell you? It says you haven't got COVID right this minute. You could actually walk out the door and pick it up off the door handle on the way out, but you haven't got it this moment, is essentially what this test will tell you. So we do need to be aware of that. Councillor McLaughlin, then Councillor Jordan.
Yes, thanks, Chair. Actually, I had some questions in relation to the 10,000 that you had available to you, which I would definitely support the rollout in the way that it's described in the report. However, since you've given us this further piece of information, the questions that I was going to ask about them become more so, really. And one is about the accuracy of tests, because I was listening to somebody from one of the Eastern European countries where they've done a mass test of the whole population. One round, I think, they've done. And then the second round they've done, it was more selective, and they just picked the areas where they had high incidence of infection. And one of the comments that she made in describing how they had managed this was that actually the more tests you do, the less accurate are the results in the biggest sense. So percentage-wise of tests, it increases. Now, you may not agree with that, but that's what this lady explained to us. But the other real thing is, which is made much worse really or much more needing to be addressed by the news they've just given us, is I was going to question the ability to train staff in care homes and the like to carry out these tests in a way that produced an accurate result. Because it's okay saying you just put it in the back of your throat, but actually it's not quite that, is it? It has to go quite far back, and it has to go quite far up your nose, and it's not just tickle in the back of your throat. So it's questioning the ability to get those staff trained and in place to actually carry out these tests. Now, if we're going to go for mass testing, and I don't think I share Councillor Nolan's view that I don't welcome it. If we had the resources, I would say, yes, let's take every opportunity we can to identify people who have got COVID but haven't got symptoms. But if we haven't got the resources to do it, and we're not in the position to get those resources in place quickly, then we probably do need to think about whether or not we want to go ahead with this. Very reluctant to say we can't cope, because you do want to be able to manage everything that comes along. But sorry for a bit of a jumble there, Julie, but if you can address those issues for me.
Yes, so I think there were two themes there, Councillor McLaughlin. One around the accuracy of the tests, and one around the training of staff. So my understanding around the accuracy is it's very good at it's very good at diagnosing when you're negative. And we're pretty confident around that. With regard to a positive test, and again learning from Liverpool, we'd follow that up with a PCR test, which is the test that's done at the moment and is deemed a gold standard. So if you went and you had your lateral flow test, and if you had a positive, you'd then be given a home kit. So you'd be asked to go home, self-isolate, do your own kit, and wait and see what the result is from that. So that's to make sure that we are getting true positives. With regard to training, we have we're hoping to work with 14 care homes across Wirral to understand the impact on the care home and to understand the training requirements. Again, the premise of these tests is that you don't have to be a trained healthcare professional to undertake the tests. Hence why we've had the soldiers over the water. So it is something that we need to explore and understand. And I share some of your concerns, because I think it's been very accurate in the lab. Obviously, when you put things out into the field, things change. It's different environments, and that's some of the learning from Liverpool. And we would need to keep a very close eye on that as well.
And Julie, if it's to be rolled out to the mass testing on the same lines as Liverpool, is there the capacity to cope with that here on Wirral?
I think, well, it would be a challenge without a doubt, and we'd have to think very creatively, I think, about how we did it. We could do it, because we can do these things, but it would be a challenge, and it would be very difficult if we don't get resources, whether that be money or people.
Okay, thank you. Thanks, Julie.
Okay, Councillor Jordan.
Thank you, Chair. Couple of things, Julie. It'd be interesting to know what percentage of the Liverpool population have actually been tested, as I understand the figures are somewhere around 110,000. I don't know what percentage of the population that is. It sounds to me around about 10, 12%, if the population is as high as I think it is.
I understand, Councillor Jordan, it's about 25% that have been
Right.
tested, but that's not just with the lateral flows, that's also
No.
with the PCR tests as well.
When it comes to the numbers in Wirral, if we take into account things like people, must be a fair number of people who live in Wirral who work in Liverpool, and I know some who've already been tested in Liverpool because they work in Liverpool. There will also be some who are on, say, the Siren study or the Principal study. And there will be NHS staff who will be getting these tests on a regular basis. So that then frees us up, doesn't it, to, if we're concentrating 10,000 tests, to do those 10,000 without taking into account the groups I've mentioned.
It does, Councillor Jordan, but one of the things with this test is about doing it on a repeat basis.
Yes.
So I think that's another challenge that we've got to think through, is how do we get people back for repeats? Because certainly they're using lateral flow tests in the NHS at the moment, and they're testing frontline staff twice a week.
Yeah.
So, and I think that's some of the practicalities that we've got to work through, really, if we decide to go with this approach. People, and it's the comment I think that Councillor McLaughlin, Councillor Nolan made. Your test is giving you the result here and now. It doesn't mean that that's going to be the same for the next, the next 2, 3, or the next week. So we've got to do a lot of comms with our local people if we go down this approach about what does a negative and what does a positive test mean. And
exactly, but I was thinking in terms. I mean, I'm on the Siren test, for example, so I wouldn't avail myself of this test. I'm already being tested every 2 weeks, and so I will continue to do that. So somebody else can have that place.
Yeah.
And I would have thought there's an awful lot of people in the same situation.
Yeah.
Okay, thank you. Thank you, Councillor Jordan. Councillor Gilchrist and then Councillor Usher.
Oh, thank you, Chair. Yes, I was unaware of the sudden offer until Julie mentioned it. I was looking at some figures the other day.
So was I till half an hour before the committee, Phil.
Sorry?
So was I till half an hour before the committee.
Yes, I can entirely understand. So we're all rather taken by surprise. When I looked at Liverpool's figure of 92,683 tests, of which in the paper I saw 648 had been found to be positive, and then I have to do some proportions from that. But it's a small proportion. Now I'm just wrestling with this because what is the time scale we have to think about it? The first worry I have is, are we being set up to fail? I don't mean that rudely, but when things are sprung on us and we're told there's no money, that is the first headache. The second one is if somebody comes along from on high from the government and said, well, you had your choice and you turned it down. When we see how it's working, or if we get offered money, do we get a chance to come back again? I feel rather like the old story about looking a gift horse in the mouth, but the purpose of that was to say, look very carefully before you take something on. And therefore, the key to me, it seems to me at times the government is still clutching at straws, and that the key to it is, what do the people who've had the test then do? And that if it's proved positive, they get this extra test and we ask them to self-isolate. But we know the present evidence, the present understanding is that the key is actually encouraging people to self-isolate, especially when the payments they get to self-isolate are modest and they're under pressure to go back to work, perhaps from employers, or they got family pressures to try and cope with the family income. So there's a whole raft of things here that might work out, but I'm conscious of all the things that could stumble along the way with, and therefore have we got an opportunity to study this offer in detail, reflect on it and ask further questions, or is it a take it and leave it offer? Thank you.
I think the negotiation is ongoing, perhaps, is what I would say, Councillor Gilchrist, and I know that Paul Sator and Councillor Williamson will definitely be pushing hard around the resources issue. our flexibility about whether we can say yes or no, I really don't know.
Yeah, I don't think it's quite clear. The impression that I was given was that this is, decided and we are going to have to do it. But I think it's not that simple to make us do something that we've decided we're not going to do. But we'll see. That on those figures you gave us, Phil, that means roughly I haven't done it exactly, but I think it's about 0.75 is the positive test on those numbers.
Thank you, Joe. They're taken from a newspaper article, which I hope had an accurate source.
Well, I mean, if they're right, I've just done it with the rough figures. I just did 92,600, but it comes out roughly 0.75. So it's not massive. Right. We've got Councillor Usher, then Councillor Frost, then Councillor Collins. Councillor Usher?
Thanks, Chair. My question's around, so obviously this is with the caveat that we really don't have, we haven't been given the resources to, or we haven't been given any extra resources in terms of personnel or funding for personnel to implement these 10,000 tests. So I suppose it's difficult at the moment to understand exactly what our capacity to deliver on those 10,000 tests is. But I do agree with the approach, which is obviously focusing on those groups outlined in the report. And I think if this is going to be scaled up, or if we were to find that we have extra capacity, like all of those vulnerable groups outlined in the report don't equate to our full capacity, I'd be really interested in working closely with schools on this, or at least considering whether schools and school children could be considered as one of the groups who are targeted for these tests, because, and I'm fine to get a steer from other members of the committee on this, but I think our message currently is that schools are a safe environment at the moment. They're great for kids, safe for kids, and it's pretty damn important for kids to have their education continue. If we were able to minimise the number of children or the length of time that children spend in community settings, when, for example, a bubble has to self-isolate because a positive test is found, I would say I think that would make sense from a public health perspective if we're saying that the school's the safest environment. So I'm wondering if that could be looked into, and we could consider schools and children in education to be as part of our groups, perhaps in a secondary tier of priority groups. I completely understand, as I say, clinically vulnerable groups would come first. So I don't know what your view is on that, Julie.
Yeah, so we're going to take the learning, because Liverpool are trying the local lateral flow tests in some of the schools. So I'd like to understand what they're learning from Liverpool, Councillor Usher, before we did it locally. We are talking with Wirral Met about rolling out testing in Wirral Met, and obviously teachers would and school staff would be a priority for us. But actually, with regard to the children, I think there's some practical ethical issues to be thought of there, because as I think it was Councillor McLaughlin said, it's not a very nice test at all, and if we're doing it regularly, so the actual impact in the school of doing it on a regular basis is cannot be underestimated. So I'd like to learn from Liverpool really about how they've got on with the school work that they've done, and I feel pretty confident that primary schools would not be part of our thinking at the moment, because we're certainly not seeing transmission in primary schools.
Right. Thank you. Thanks for that, Julie. Councillor Frost.
Thanks very much, Chair. My second point relates to what Councillor Usher was just talking about. So my first point, very supportive of the 10,000 and the 10% opportunity. I think it's already been discussed around what learnings we can take from Liverpool, but my hope is that they'd be quite forthcoming in sharing any of the learnings that they've had, whether it's on the training front or whether it's on, as you talked about, the ability to embed it in workplaces and such locations. So I'm hopeful for that. My second really is around not the new information, but on the report document and understanding the role for school staff, teachers and children's. The reason I think it's quite front of mind, and it was really helpful to get the breakdown, Julie, of the priority members of our community. In the weekly council COVID dashboard from two weeks ago, I think this one was, in terms of the numbers that we were seeing at that point, the top 4 locations for current open cases, 26% were in secondary education. So it does seem very front of mind for me in terms of that being a significant area. And you mentioned just then, Julie, that based on the difficulty of doing these tests regularly with children, primary school children, you said primary schools wouldn't be on the list. Primary schools were second on that, so they were 17%. Appreciate those numbers. I think the report says they don't cover business reports, but those two numbers, 26% for secondary education and 17%, do seem high enough for me to warrant understanding where they sit on that priority importance list.
Yeah, I think why I'm so strong about the schools is because I believe we've got a really good offer with our schools through the support that we're putting in. So actually, as soon as we know about any case within a school, then support is offered, and I think we've worked really well with our head teachers, and the head teachers and schools have just been amazing in the way that they've responded to this. And if we compare where we are with our counterparts in the rest of Liverpool City region, we've been able to keep our children in school much better because I think of that working relationship. So this would be at the moment, I believe, very much a focus on it would be that a focus on the school staff as opposed to pupils. So we will definitely look at that going forward.
That's helpful, Julian. I'm with you in terms of the staff. I think from a few conversations I've had with people who work in schools, I think the one push to head teachers in amongst the fantastic work they're already doing is on the recording of absences, whether it's an absence that's recorded and then reported as a COVID absence, or whether it's just logged as a non-COVID related absence, but likely to be one that's not coded. In terms of, I guess, the data that you're using, I think that could be something that obstructs the numbers, because if it's just a child is absent for another reason, as opposed to them being absent, that would be, I think, the one push in terms of making sure that that's really recorded. But I'm with you, I guess, in terms of the data tells us that those who are most at risk at school are the adults, and so that would be teaching and non-teaching staff. Okay, thanks, Julie.
Right, thank you, Councillor Frost. Councillor Collins, then Councillor McLaughlin.
Thank you, Chair. Good evening, Julie. It's just a quick comment. A lot of what I was going to say has been covered, but I'm concerned about the positive tests with this LFT pilots that we're doing. So if they have come back as a positive, they're then sent home to isolate and do their own test. Is that what I've understood? Now, those who've had the test, which I'm one of them, it's quite an invasive and not a very nice test, has been said. If people aren't trained to do it, and you're expecting them to go home and do that test for themselves, are you going to get a true reading, or why can't they, if they've got a positive test from the LFTs, do the PCR test there and then?
That's a good question, Councillor Collins. I'll take that back and think about it. I mean, I'm telling you, we only got to know about this afternoon, so we're just processing really and trying to pick up from what's happened in Liverpool. But I don't know why Liverpool decided to go down the route of sending them home with a home test. I'll ask that question.
Yeah, as I think it's just, especially if we're looking at training people to do it, especially in care homes, what have you, that shows that people need to know what they're doing. And if they don't do it properly, you're not going to get a true report. So it's just something to throw in the mix.
Yeah.
If they're there on site, why can't they be done? If we are doing the RFT tests, why they can't just get the PCR test at the same time?
Yeah.
Thanks, Chair.
Thank you for that, Councillor Collins. Just in relation to Councillor Frost's point about sharing information from Liverpool, I've got a meeting on Monday with all the other chairs of health across the Liverpool City region, and the Director of Public Health from Liverpool is coming to talk to us about the impact of the testing. So we will hopefully get some really useful data out of that. Councillor McLaughlin.
Yes, thanks, Chair. I mean, that's good to hear that you're going to be getting first-hand information from the Director of Public Health for Liverpool on what's happened there. I would just like to highlight the fact that though we are talking about fairly small numbers who've been identified as being asymptomatic in the Liverpool experiment, actually, if we're talking about each of those 650 to 700 people contacting and passing it on to another 2, you started to talk about thousands of cases, which is a significant impact on the whole way the things are going. But that's not really the main point. The main point is, if you get to the point, Julie, where you've looked at this and you really don't feel that Wirral is going to be able to muster the resources to do a whole population, or at least offer a whole population testing, would an alternative be to increase the target groups that you're going to do to slightly more or less vulnerable than the ones you've actually already identified? Would that be a sort of halfway house that could be done?
Yeah, indeed, Councillor McLaughlin, and I think that would be my preferred approach. So it would definitely be that we could offer it to supermarket staff, for example, or taxi drivers.
Taxi drivers, people who are driving buses, public transport workers, things like that.
Yeah. And I could see again that this could be an opportunity. So I think the big thing about these tests is trying to drive down the transmission, and of course we've been doing that as well through lockdown. So for me, there's something about these tests perhaps coming into their own more when lockdown's lifted and there's more mixing, and we're trying to still keep that transmission suppressed in the borough, and so therefore we might well want to use we might want to work in a particular community, perhaps where there's a particular issue, and we could do the lateral flow test there. So it's much more targeted and focused rather than an offer to everybody. But these are all the things that we need to work through.
Sorry, as a further suggestion, or just go into the wards where they've got the highest concentrations at the moment, because I know 2 of them are Birkenhead wards, aren't they? So it might not be a bad idea to concentrate on those 2 wards.
Thank you. Thank you, Julie. I've got Councillor Burgess-Joyce somewhere. I did have. Oh, you put your hand down.
Yes, sorry, Chair, it was a legacy one. I realise that. Sorry about that.
Legacy hand, right. Councillor Usher, is yours a legacy hand, or have you got something else to say? Hello, Councillor Usher. Is there anybody there? Well, let's assume not.
Sorry, Chair,
You've got a hand up, Tom. Is that a legacy hand?
Yeah, sorry, apologies. That's
right.
I just
that's
said
fine.
my name. Sorry.
That's absolutely fine. Okay. Well, thank you very much for that report, Julie, and then we'll move on. Oh, and just for a change, it'll be Julie again.
Sorry,
Councillor.
Councillor.
Move the agenda around.
Sorry, Chair. Can we just move and second that recommendation?
Yeah. So the recommendation is that we're asked to note the recent developments and support the proposals on the targeted rollout of lateral flow testing. Because this minute we don't actually have any proposals around mass rollout. We've only just found out that we may be told that we have to do it, but we'll worry about that as and when that happens. So we're being asked to support the plans for a targeted rollout of lateral flow testing.
I'll propose that, Chair.
I'll second, Chair.
Thank you. Can we take that by assent?
Yes, agreed.
Yeah.
Agreed.
Yeah,
Right.
so I agree with that. I just stuck a note in the chat, Chair, of some thoughts on what we've just been discussing as well.
Okay. Do you want to make those thoughts public, Phil, or are you happy to leave them in the chat? Oh, there's a lot of them. Yes.
I have to
Lots
mention
of
them
thoughts.
in the chat column, because of course the public don't see it. I stuck, my conclusion is that it would be prudent to explore the use of the 10,000 tests on offer, but we must be clear that this will take time to organise and be targeted to the sectors that members have mentioned, and it should be backed with additional funding and publicity. My feeling is that it is more likely to be successful if a culture of self-isolation can be established.
Yeah, I would agree with that. I really would. Right. Okay, so as I say, she should have let me change the agenda around. It's you again, Julie.
Yeah.
Contact tracing.
Okay. Thank you, Chair. So this report is asking the committee to support a recommended option to deliver locally supported contact tracing. So the report gives you an outline of contact tracing, and as you will all know, testing and tracing are the two of the key ways that we're going to learn to live with COVID and manage COVID, are particularly important whilst we haven't got a vaccine. So the paper actually outlines three options that we looked at with regard to contact tracing. We were asked to get involved with Public Health England on a locally supported contact tracing work, whereby we follow up people that have been lost to follow up by the national system within 24 hours. And we've started to do that work. So we've looked at that as an option, so that we just continue to do what we do at the moment, but we don't believe that gives us the flex that we need to work with local communities. We looked at an option of where we do locally supported contact tracing, but also enhance that when we know that we've got high transmission risks. And we did this certainly earlier on in the pandemic when we saw an outbreak in various settings, and we were able to do local contact tracing alongside the national system. And then the third option we looked at was whether or not we undertook all contact tracing locally. The preferred option, and put to you in this paper, is to continue with our locally supported contact tracing and continue with the local contact tracing where we've got high transmission risks. We believe that just doing locally supported contact tracing doesn't give us the flexibility that we need, and we believe that doing all contact tracing locally is a duplication of the national system that's been established. So I'd welcome members' comments on those options, but the option that I'm putting to you as a recommendation is the locally supported contact tracing plus targeted local contact tracing. Thank you, Chair.
Thanks, Julie. Councillor McLaughlin.
Thanks, Chair. I have to say, I think confidence in the national testing system is probably very low. And I could give you several examples of how it's signally failed to contact people that in my family that have been in contact with it. So, I mean, if we had the resources, I would favour option 3, but I think we have to be realistic. You haven't got the resources to do that. So the preferred option for me is option 2. But can I just check with you what happens when we're crossing local authority borders here? A couple of cases that, in my own family, I have to say, I don't like to use personal experience too much, but you have to use first-hand knowledge, don't you? Where infection has taken place across the border early on, but no contact tracing has taken place outside of the area, Cheshire West and Chester, actually. Contact in Wirral, but no contact was made. And another one, as we both, myself and Jeff Green have highlighted, hospital testing on admission, and those results never, I mean, in the end, Elspeth got the result for my family member, but the results are not being passed to the person. But the issue really is whether, if we had the resources, I'd prefer option 3, but we haven't. So being realistic, option 2.
So the issue about the hospital, Councillor McLaughlin, we, as you know, we have taken that up with them directly, and we are also working with them to put in place a local pathway with regard to contact tracing. But yeah, we're taking it up directly with them. With regard to, so boundaries should not matter with regard to contact tracing. That's the whole rationale behind it.
The other thing that happened, and I know these aren't isolated, but it's one of my daughters actually. She's part of a family unit of 6, and another daughter had been there because she's in a bubble with her. She was never been contacted yet. She has self-isolated for 2 weeks because, you know, she knew she had to, but she's still never been contacted. But what happened was my daughter got 5 phone calls altogether, 1 in Chester, but also the children were getting phone calls, and one of the children is 10. One of the, you know, it just was chaotic, to be quite honest with you, and doesn't inspire confidence. That's the nub of what I'm saying.
Yes, and unfortunately, I've heard a number of examples that, where the system has not done its job, quite frankly. So one of the benefits of being in Tier 3, if I can say that, is that we do have a direct line into the national system, and we are feeding back across Liverpool City region any examples that were given, such as this, to help inform the national system and get them to amend their protocols. And certainly I know they're going to stop phoning children, because that's certainly been something that's been highlighted to them. So I know that is going to stop. But if there are examples, then if people let me know, I can certainly make sure that's fed up into the ongoing debate we're having with them about how they change their script and how they become more, just how they change the script with people. But I'm through the locally supported contact tracing. People should be getting a call from an 0151 number and have somebody on the phone with an accent like mine.
And I'm sure that will be a much better way of doing this. Thanks.
Thank you. Julie, I've got Councillor Frost and Councillor Gilchrist.
Thank you, Chair. Thank you for the report, Julie. Very much in the same way, the same vein as Councillor McLaughlin. If we had the capacity, the resource and the expertise, I would absolutely back you and your team to do something that was completely local around the final option there. I think it regularly gets referenced as the National Track and Trace or NHS Track and Trace. I think my intention, to demonstrate clarity, Serco's Track and Trace has been, a national shambles by all accounts. And I think there's been some really clear examples just shared there locally. And it's helpful to us to know actually that we can feed in those examples that we get from residents, and we definitely will be doing so. But based on, making sure that we have the best use of local intelligence and using as much resource as we have available, very, very supportive of backing your recommendation for option B.
Thank you. Thank you very much, Sam. Councillor Gilchrist.
Thank you, Chair. I will back option B in the circumstances we face. It seems to me that, I'd like to check up on how quickly the hotline to higher authorities works and how quickly we're getting information now, because it seems to me the speed of being able to get hold of people is the key thing. But it's amazing that we have to argue to try and get money or struggle to try and get money. And at the same time, in another world, big companies are just offered it on a plate. And they've already been named, like Serco and Sodexo and Mighty, and various companies seem to have these contracts which they appear to have acquired relatively quickly and easily. There must be a point at which those contracts can be wound down and the money transferred to the people who can actually do the job. But as things stand, I'll go for option B for the time being. Thank you, Chair.
Thank you, and I absolutely echo those sentiments, Councillor Gilchrist, completely. We've got an awful lot of agreement breaking out tonight. It's no fun at all. Nobody's arguing with anybody. Right, are those legacy hands? Councillor McLaughlin?
Apologies, yes, sorry.
It is, right, okay. Right, are there any other comments on the contact tracing? If not, can somebody move the recommendation?
Happy to move, Chair.
Thank you. Seconder, please.
I'll second.
I'm happy to second.
Oh, go on, leave.
Yeah, right. Councillor Gilchrist, you're doing it? Okay.
Yeah, thank you very much. Thank you. Thanks, Moira.
So the option is the second option, where we're delivering locally supported contact tracing plus the targeted local tracing where our intelligence identifies high risks. But basically the second option in Julie's paper. Right, now you're off stage for a bit, Julie. So we're on to item 7, the performance monitoring, and Jason, I understand that you're giving us this paper tonight.
Thank you, Chair. Thank you, Chair. Yes, good evening, members. So this report is for performance of adult social care and health up to the end of Q2, which is up to the end of September. Members are recommended to note the content of the report and to highlight any areas requiring further clarification or action. I'd just like to draw a couple of areas to the attention of members in the main body of the performance reports, which is included. So I did want to highlight the number of people living in care homes, which is on page 45 of the electronic pack. So the number is currently at the end of Q2, 1,576. And if you look at the tracking line across, it's relatively steady over the last couple of years with a gradual reduction. And that is in the context of demographic growth with a significant increase in the older people's population in Wirral, and particularly those older people living with dementia. So that might otherwise be expected to have increased if we hadn't have been doing a lot of work to keep people in their own homes. So in line with that, I'd like to also mention the amount of domiciliary care and reablement that we provide, which has seen a significant growth. So we currently provide about 1,600 hours of domiciliary care per week, which does demonstrate that we are keeping people at home wherever we can and avoiding long-term care home placements. The other areas that I wanted to just draw members' attention to is the social work performance areas, which are, I'm just getting to them, on page 55 of the electronic pack. So this section details some high-level key performance indicators for the social work teams in a community care and health trust. We've got very good performance around assessment timescales. So 90% of assessments are completed within 28 days, and that's remained at around 90% despite the pressures in the system with COVID. So that's good performance. And the one underneath it is the number of safeguarding contacts that are made to teams that are triaged within 5 days, and that's 100% performance. So that's very good activity. 2/3 roughly of those safeguarding investigations where they're required are undertaken within 28 days, with roughly about 1/3 taking a bit longer, often due to more complex investigations. A slight dip in the rate of reviews, planned reviews that are undertaken is reported, which tips it into amber from previously reporting as green. But I would stress that this is in the light of prioritising services and response to the COVID pandemic and the pressures within the system. So I would expect a level of tolerance around a slight reduction in reviews. And then finally, I would just mention the number of people with learning disabilities who are living in their own homes or with their family members, and that's at 94%, which is a good performance and an increase from earlier in the year. So members are asked to note the content of the report and to highlight any areas for further clarification or action. Happy to take any questions.
Right, well, thank you. Yes, there's quite a few hands up there, Jason. So, and certainly I will echo the comments made last time about the vast improvement in the report and what's being reported to us. Reviews, the low number of reviews is one of the things that I've noted, and that does concern me, because obviously the reviews are part of ensuring that people are as independent as they can be and ensuring that we have the right services in place at a level that is necessary and at a level that's appropriate. So, I mean, reviews are important. Another area that I would like to see on that data set is our DOLS reports, the DOLS figures and the DIDS figures, please, both of them. I think that's really important, and especially now where there are issues around isolating and being tested, and where we have people who lack the capacity to consent to that, and we are making best interest decisions on their behalf. I think it's important that the committee is aware of how many of those are being undertaken. So if that could possibly go on, I'd really appreciate that, Jason. And I've got... Okay, Councillor Collins, followed by Councillor Gilchrist.
Yes, thanks, Chair. Thanks, Jason, for the report. I've got a couple of concerns, but my major concern is the amount of care home or homes that have been graded below good. So we've got 95 that either require improvement or are inadequate. Now, our residents who put their relatives into care homes are expecting them to be looked after. Now, what are we doing to ensure that those care homes, one, either don't get any further contracts, or two, that they start to improve and get into the good? And is there any way of saying to the care homes, saying, if you're not going into good, we won't be looking at you for further contracts? Because I would be very concerned putting any relative into anything that's below good.
Thank you, Councillor. So yes, in the report there are 91 rated good and 69 requires improvement. And 26 inadequate. So that's across all care settings, as I understand it. So the work that we're doing is largely through our quality improvements and contracts teams. So we do invest in a team of quality improvement staff that work across the local authority and the CCG to do very targeted work with homes that fall into requires improvement or are inadequate. And homes are required to produce an improvement plan and are then held to account for their improvement and subject to checks around progress of their performance and standards. We have seen some increase in quality in care homes over the last year or two, and we've also seen one or two homes that have left the market. We do have a process in place whereby care homes that continue to perform below expected standards and remain inadequate, we do have a process in place where we can suspend placements for new people going into those homes. However, unless the home is subject to CQC action, people may still choose to make their own private arrangements within that home by their own choice. So we do quite a lot of, well, we do a lot of proactive work with the care home market, and we are seeing some improvement, but I do recognise that we've got further work to do to get to an acceptable level of quality.
Just following on, if you don't mind, Chair, just a quick one.
Yeah, if it's quick, yeah.
Yeah, you said about the inadequate care homes, which are 26. You've still got a large number who require improvement. What punitive measures or what measures are you taking to ensure that they do raise their standards to ensure that they get into good? Because we should, I feel as a council, if we are going to put money into care homes provided for residents, we should be looking at good care homes, and anything that doesn't fall into that category, we should be saying to them, you're not getting anything off us until you get into good.
Yeah, so care homes that requires improvement on a continual basis, or keep dipping in and out of requires improvement, we do take measures in terms of suspending new placements, which means that we're not then placing funded service users, people into those care homes. So they do feel a disadvantage of their poor performance, and there is an incentive for them to work with our quality improvement team to raise their standards, to resume placing more people with them.
Thank you, Chair.
Okay, thank you. Then I've got, where's my list? Councillor Gilchrist, then Councillor McLaughlin.
Yes, thank you, Chair. And the points raised by Councillor Collins, we often discussed at a particular panel and working party last year, and I'm really hoping for a time when we can almost have a charter mark for our homes in Wirral as part of a new deal with the council to get the service on a good even keel, especially given our decisions about the real living wage. I've been looking at the graphs, and it's useful to have what I might call a long view of how things have progressed over time. Sometimes I have a little problem following the graphs. I just had a query on page 7 of the documentation about carers' respite. We have a total number of respite days, and the title of the chart talks about since April 2019. But if I'm looking at the small print, the chart seems to cover from April 2020 rather than 2019. It might be me misunderstanding or a simple transcription problem. In terms of having the long view from last March through to list October, it does give us a clear picture of what services we provide and spend on, because when the public can appreciate just how much time, effort and funding goes into the care services, they would have a greater understanding of what we're trying to achieve. Thank you, Chair.
Right, thank you, Councillor Gilchrist. Yeah, I would agree with much of that. Yeah, I suppose one of my comments, it's not directly related to the figures, but I'm aware that many carers, in fact, most local authorities these days don't call it respite. They actually call it short breaks, because carers have made the point that, by and large, the people they care for are very dearly loved, and it's not about a respite from them. It is about a short break. So a lot of carers don't like that phrase. I don't know, Jason, if that's something that's been raised here.
We do often refer to breaks for carers from their caring duties as a short break. Yeah. So I think there is an element of, sometimes we use terms, we use the respite term and sometimes short breaks. I'm very happy that we use short breaks. I think in the majority of our day-to-day work, we do refer to this type of service as short breaks. So I'd fully take your point, and we can perhaps make sure we're more consistent with our terminology in future.
Councillor McLaughlin.
Thank you again, Chair. I have to say the presentation is a huge improvement on what we were getting. It's really very easy to read and very easy to make comparisons. I think it is helpful to see the regular indicators about care homes, just so it keeps our mind concentrated on them. For the last, certainly, probably as long as I've been involved in adult social care, actually, we have been highlighting the fact that our care homes, a lot of our care homes do not provide care at the standard that we would like, and I know an awful lot of work goes in to try and drive the standards up in these care homes. They've had a lot of investment lately, and I hope that that will start to come through in the way that they are performing. However, I thank you, Yvonne, for dealing with the issues of safeguarding and the annual review, both very important issues that I was going to raise. But the one that I don't think you've dealt with, Jason, is transfer to assess. The numbers there have dropped. Is there a particular reason? Is it related to COVID? Is it related to reduced discharges or whatever? Would you like to clarify that for me?
Certainly, thank you, Councillor McLaughlin. So yes, I had a look at that in this report, and I can certainly do some further work to provide you with some detail and information around that. But I am aware that of our block booked commissions for discharge to assess beds, several of the settings over the course of this reporting period have had some temporary closures due to COVID outbreaks. So I do think that is showing in the data. So some homes haven't been able to take admissions for a period of time, sometimes 28 days. And also, I do think this probably explains some of the differentials in the length of stay, average length of stay in the D2A beds. So I think the data is slightly variable in this reporting period because of outbreaks and temporary closures.
Thanks, Jason.
That makes sense. Right, I've got Councillor Frost, then Councillor Jordan, then Councillor Cannon.
Thanks very much, Chair. And Jason, thank you very much. I think the comments have been made by a couple of members now, but a really huge thank you to you and the team for the quality of data presentation and the way it's been structured. It's a really comprehensive report that gives us an awful lot more information than I think we were able to have before. And I could even hear that from the conversation that's just happened these last sort of 5 minutes or so. I think based on the conversation that we've just had, one of the things that I was wondering is whether we wanted to talk about maybe a working party or a working group to talk about the kind of data reporting and analysis based on the conversations that's just happened now, and the quality of information we can now get out of our data. It seems to me that there's so much that could help us inform the upcoming agenda based on people, whether it's a small subgroup or this collective. But it is in my mind about how all of this information helps us rather than just be reactive in the moment like this. And you've kind of said, sometimes they'll be slightly out of date, how we can use this data to be, whilst we still will react because it is data that looks back, how we can use it to inform the agenda that rolls forward. Jason, I don't know if that's something that you and your team had any discussions about, but I'd be really interested in hearing your perspective on that, and then any other members, if other members think that's a good idea.
Certainly, thank you, Councillor Frost. Yes. So much of the data is derived from our Power BI systems, and some of it is very current and up to date and can be reported on in almost a real time. So I think members of this committee have previously discussed whether or not they may wish to explore access to Power BI dashboards, which is certainly something we can explore and facilitate. And the other suggestion of a workshop or a working group to look at the performance reports and how that data can be developed or presented differently, we would absolutely be happy to facilitate and support that if members would wish to do so.
Excellent. Yes, I think I'm seeing Councillor McLaughlin has put in the chat that she supports that idea. I certainly do. In fact, this vastly improved data set was as the result of a workshop of members of adult scrutiny. around what we wanted to see in a data set. So just goes to show we can be fairly helpful when we're all involved. So yeah, I think that's a really good idea, and I think we should look to members who are interested and want to do that.
In terms of that action next, Jason, is that something that you and your team will lead with members, or would you suggest that we come to you? How do we take this one forward?
I would suggest if committee members agree that's how they would like to do it. I think committee services could probably facilitate a workshop.
We'll be looking at
members and officers together. Yeah,
we'll be looking to Vicky to get that organised. Sorry about that, Vicky.
Fantastic, thank you.
Okay, Councillor Jordan, then Councillor Cannon, then Councillor Burgess-Joyce.
I know that Councillor Jordan's having real problems with her. Oh, she's back.
Oh, there she is.
It's okay. Thank you, Chair.
Back in the room. Hey.
Thank you. I couldn't get the mute off. Perhaps it was trying to tell me something. Thank you for actually reminding me of a question I wanted to raise at the last meeting. My question, Jason's around dolls and the number of dolls that are rescinded, or well, not rescinded, but are stopped early, basically due to the person dying. And in my opinion, these dolls are in place inappropriately. If somebody is approaching end of life, then they should be taken off the dolls. It should be rescinded. There was a time when somebody who was approaching end of life or died with the dolls in place was referred to the coroner, which was a horrible situation for the family and for the staff. But we still have this situation where people are dying with the dolls in place, and I'd like to know how many people are affected in this area by that.
Yeah. Excellent question.
Jason, if it helps, if you don't mind if I interject here, dolls is about deprivation of liberties, and anyone that requires to be kept into a single place or a care home with a locked door has to have a deprivation of liberties in place. The legislation doesn't cover whether the person is, what their condition is, how ill they are, etc. So many of the people that we have under deprivation of liberties orders are very frail and very elderly, as well as people with acute mental health problems. So it's not something that we can, say, well, actually, we're not going to apply dolls in this case because the person's so poorly. The legislation doesn't allow for that, Mary. So there may be some, if you like, a national issue around this, something that can be looked at.
There was, Graham. Some time ago, I was involved in trying to change the legislation. I was working with the National Dementia Czar because we found an awful lot of people were dying with the dolls in place. If you're hooked up to a syringe driver and unconscious, you don't need a dolls. And having to have a referral to the coroner is so upsetting for staff and for family. I mean, I know that referral now doesn't go ahead, but it really isn't appropriate to have a dolls in place when somebody is at end of life.
I think the difficulty for us in social care is that the majority of people that this applies to, people with dementia, are terminally ill. They have dementia. It's a life-threatening disease. They are dying by, so it is very tricky, that. And I think we would get a lot more stick if people didn't have dolls in place and were dying in care homes. And I think that's the difficulty we would have. So, a change in the legislation would help us in this case, but it's something we have to work with.
I think that's right, but correct me if I'm wrong, Graham, but I'm pretty certain that there is guidance around not implementing dolls where people are actually at the end of life. When they're on an end of life pathway, then we've had guidance, I think, probably about 5 years ago,
Yeah, I do think end-of-life pathway specifically is different to all people on doles who die, and I think
Yeah, well,
that's
yeah.
a very different issue, isn't it?
That's exactly what I'm talking about. Yeah.
Yeah. So, and I'm pretty certain that there is guidance which says it's not appropriate, not needed. It's intrusive, it's invasive, and it's not appropriate. I'm pretty sure about that. I dare say I can dig around, find it. It'll be there somewhere. Right, does that answer your question, Mary? You okay with that?
Yes, it does. I mean, it's always concerned me from when I first heard about the issue, and it still concerns me today, even though we don't have the coroner involved. I do think that once people are on that end-of-life pathway, things need to change.
Yes, and absolutely, Graham's right, on the end-of-life pathway, as opposed to somebody with who's got a terminal illness. But once people are at that final point and receiving end-of-life care, then I would absolutely agree that's not an appropriate time to implement a DOLS. Councillor Cannon.
Thank you, Chair. Jason, it was just a clarification, really. This question was actually asked in audit and risk earlier on in the week about discharge from hospital to care homes. And on the risk register, they were concerned about what had happened earlier on in the year with people being discharged without COVID tests into nursing homes and care homes. And then obviously, unfortunately, the COVID running rampant. Chair couldn't actually answer the question about whether we have any control over that as a local authority. I thought it might be quite interesting, and obviously to clarify that for the public, obviously who weren't, that wasn't an answer given on Monday, about whether we do have control or whether that's solely up to the NHS, because obviously, you know, we're desperately to protect our residents, and I'm sure you and Graham are as well. But it was just clarification, because obviously we didn't get that answered on Monday. That would be really useful.
Certainly, Councillor Cannon, thank you. So we followed the guidance from the Department of Health and Social Care throughout this pandemic response. Nobody is discharged from hospital into a care home without a test being undertaken and the results known prior to discharge. We have that hasn't been the case throughout the pandemic response. We've followed the guidance. The current guidance is that testing must happen before discharge to a care home, and that is followed. We're very fortunate in Wirral. We have a very integrated system, and we have excellent communication with all of our NHS partners on a daily basis. So we really do monitor this regularly in terms of pressures and numbers and discharge arrangements and so on. So people who are patients in hospital who have a diagnosis of COVID positive, COVID-19, they do continue to be treated in hospital and remain in hospital for their isolation period prior to discharge into a care home. Some people do continue to test positive beyond 14 days and well beyond displaying any symptoms of COVID-19 and are considered to be a very, very low risk of infection to others. And we do have a pathway that enables people to be discharged into care homes through careful risk assessment and by agreement with the care home where that's the case and they remain testing positive after 14 days. But our current practice is that we do have complete control over this, and we don't discharge people into care homes without knowing their COVID status and not during their isolation period at this current point in time.
Jason, thank you very much for that. I think it was important for clarification, both for people that are watching Audit and Risk and obviously for everybody tonight. Thank you very much.
Thank you.
Thank you, Councillor Cannon. Councillor Burgess-Joyce, then Councillor Cottier.
Thank you, Jason. I think you're a good egg. I think that's an excellent report, and I have to say very, very useful, very informative. I'm going to sort of go back to possibly something that Councillor Collins mentioned before, which is around the standards of some of the care homes falling short. But it also adds on to the concern that we raised, I think, at the last meeting, which I certainly know the Chair made comment on, which was around care homes paying the real living wage. And it concerns me greatly that the real living wage or lack of payment of it may actually correlate to some of the standards within those homes. I don't know for certain, but I'm taking a guess here. I'm just wondering, and I apologise, Graham, for an old sort of chestnut here of mine, but is there some way that rather than just issuing concerned letters about the standards within those care homes, we actually revisit them and maybe ask for some of our money back? I know this is something that Graham and I had a bit of an email exchange in the week, but there's got to be something tangible, and many of these care homes will appreciate the fact that if there's a financial penalty, they may need to do something about it. But I think we all have a concern about the real living wage not being paid to people who work extremely hard on behalf of our loved ones.
Thank you, Councillor. So there's a couple of issues there. We can certainly do some analysis and provide members with some information around whether or not there's any correlation between quality and the inspected status of care homes and whether they pay the real living wage or not. We can certainly have a look at that and provide some information if that's helpful. What I would say is that the care home market is actually quite a fragile market at the moment. We rely fully on the independent care sector to meet the needs of all of these vulnerable older people that require this level of care. And during the pandemic response, there's been a lot of national and regional debate and concern over the sustainability of the care home market, given the level of vacancies because of admission rates slowing down and the level of vacancies carried. So the performance report shows a pretty much sustained level of average vacancy rate of 14% across our care home sector in Wirral. So in terms of financial penalties, some of the care home sector is experiencing additional cost and expense through the pandemic response, and they have worked very well with us as commissioners to meet the needs of the local population. The other thing I would just comment back to you, I suppose, is that the care that's been delivered has been paid for. So if a care home requires improvement or even inadequate, we've paid for the care that's been delivered, and the vast majority of the payment that we make to the care home is actually staff time, which has been delivered. So it would be quite difficult to apply a financial penalty after care has already been delivered, and it may well contribute to financial difficulty for that care provider. So it is quite a complex area.
I do appreciate that answer, Jason. I do understand where you're coming from, but I do think it's worth putting a shot across people's bows that we will not tolerate, poor performance, not least of all from the fact we're not paying enough, which is certainly what Yvonne Nolan mentioned at the last meeting, which I couldn't disagree with, in fairness. But thanks very much, Jason. I appreciate that.
Right. Okay. Thank you. Thank you, Jason. I mean, yes, it highlights very well, doesn't it, the issues of having a marketplace for care rather than a publicly funded service that's publicly delivered. Then we wouldn't have these issues. However, and we also have a responsibility under the Care Act to maintain that marketplace. So it's an issue. I have just been reminded by the Borough Solicitor that we have been going for 1.5 hours, and I need to ask if members would like a comfort break at this point.
Chair.
Just ask if we could formally move and second that recommendation from that report before we...
Well, there are still speakers, Vicky, which is why I haven't done it yet. I've still got Councillor Cottier, and the Director has put his hand up to speak. So I'm going to bring in Councillor Burgess-Joyce. Was that sufficient answer for your question?
Yes, thank you, Chair. I appreciate that. Thank you.
Okay, thank you. Councillor Cottier.
Thank you, Chair. Yeah, and thank you, Jason. Again, don't want to gild the lily, but we'll echo everyone's thanks for the clear report. If I can follow it, it must be clear. But it raised, you did highlight the reablement, the 91 days reablement graph, and you did mention that COVID might skew the the latest data, which takes us up to 94%. Now, it does say service users at home after 91 days. Now, when you mentioned COVID, I automatically thought of a family bubble. Is that service users living independently in their own homes, or is that service users living in a family bubble because maybe parents of service users have taken them back into their bubble? And it begged the question then, is this actually clear that the service users are living in their own home independently rather than at home with others, if that makes sense?
Thank you. I think I need to clarify my response to that one, to forward you a response after this committee meeting. My understanding is that it's remaining in their own homes 91 days after reablement, but I'm not sure if that can include where people are temporarily staying with other family members in their homes. So I would like to clarify that and come back to you, if I may.
Yes, please, Jason, because that would throw a whole new perspective on the previous data as well. If you could clarify that, please, that'd be most welcome. Thank you, and thank you again. Cheers, Chair. Thank you very much.
Okay, thank you. Graham.
Thank you, Chair. And it was just a couple of points of clarification from myself on the care home situation. As it stands, the council currently commissions about half of the places from the care market, from the whole care market. The other half is people that go directly themselves. What this leads to is a situation where some care providers are very reliant on council contracts, and some care providers are not reliant at all on council contracts. In fact, all of their fees come directly from individuals. What that means is we have limited control for some providers, and when we've offered the real living wage across the whole sector, those that are reliant on council contracts have found it very positive to take the extra money and to pay it to their staff. Some of the others, who actually might be considered to be high quality homes, have decided not to take the real living wage from the council because they would get very little additional income from the council but have additional costs themselves to their staff. We also have a group of homes that already pay the equivalent of the real living wage or more in their own private arrangements. So there's a real mixed bag. I would agree with the chair. The real issue here is that we have a very diverse market, and we have statutory duties to manage within that market and work with the market. But there isn't a simple issue that says poor care homes don't want to pay the real living wage. It may well be that the homes who have slightly lower quality are more reliant on council contracts with less people going there directly themselves. So I think Jason will provide the additional data. But the only other thing I wanted to come back on was that Councillor Gilchrist has raised the issue of the quality standard. We have taken that as an action and we'll also come back on the development of quality standards, etc. Because we will be paying at least on a two-tier rate in terms of those providers that pay the real living wage and give it to their staff will continue to be paid more than those homes that don't pay real living wage to their staff. So we will have a two-tier approach anyway. So I think linking that to quality standards will be an important factor for us. Thank you.
Right, thank you. Thank you for that, Graham. So can we have a formal mover, please, and seconder for the proposal that we note the performance monitoring report?
I'll propose.
Thank you. Seconder?
Seconded, Chair.
Okay, thank you very much. And I think we've already had thanks of the committee for that. Right, would members want a 10-minute break at this point?
I'm happy to carry on, but obviously if people do want one, then, you know, that's fine by me as well. But we're near the end of the agenda, aren't we?
Well, that's what I'm thinking.
I'll happily carry on.
Let's carry
I'm
on.
happy to
I'd
carry
rather
on.
carry on. Thanks, Chair.
Okay.
Yeah, I'm happy to carry on as well.
Good. Well, that seems like we've got all party agreement on that. In which case, then we come to the work programme, which is just an update really on the work programme. If you remember last time, we said that we would keep the work programme as flexible as we could so that we were in a position to respond to COVID as it developed, and the situation developed as it seems to do. Every couple of days, something changes. I'm not sure who's taking us through this. Is it you, Graham, doing the work programme?
Apologies, Chair. I hadn't realised I was taking you through that. But yes, happy to work on that with you.
Yeah.
Yeah, just opening the PDF now.
Okay. I mean, yeah, obviously people are welcome to comment and to look at what they want to add into that or take away from it. But as I say, it's important we keep it as flexible as we can.
Yes, yeah, absolutely. Okay, so so members have been invited to note and comment on the committee work programme for the remainder of 2020-21. Now, clearly, there is flexibility within that in terms of being able to raise additional items or to prioritise the work programme in terms of that level of flexibility. And clearly, Chair, you've mentioned the COVID-19 response and all of those issues, so that I think that having that level of flexibility is very important.
Okay. Any comments from anybody on the proposed work programme? Any objections to what's on there? Anything to add? Anything to take away? No? A happy committee. Very good. So will somebody then please move the recommendation, just to note?
Happy to move that, Chair.
Thank you. Thank you, Phil. Thank you, Moira. Yes, we were invited to comment. Nobody did, so fair enough. Which brings us, back to Julie. You're on stage again, Julie, for item 9, the COVID update. And I would just say to you all that I have an item of urgent business after that, which is the feedback and comments from the budget workshops.
Thank you, Chair. as just been mentioned, I know that the committee wants an update on COVID every time you meet. We're just trying to work through how best to do that presentation for you, because one of our challenges is the fact that as you've just mentioned, Chair, things change very rapidly. So what you have got in your papers is a link to the data that we publish, and we publish data on a weekly basis on the Wirral Intelligence site with regard to the current status with regard to cases and activity in the hospital. But I thought I'd today, and obviously we actually monitor it on a daily basis. So I thought today, if I just gave you the latest data with regard to COVID within the borough, just a little bit of a reflection really that up until the 24th of August, we were seeing around about 2 to 6 cases of COVID-19 a day. On the 24th, it went up to 16, and that's when things started to change for us. And on the 19th of October, we recorded the highest number of COVID cases in the borough on a single day, which was 226. We're currently recording around about 74 cases per day, and I'm pleased to say that our rate is going down. We've now got a 7-day incident rate of 174 per 100,000 population. My reflection to this is it's really good news, because at our highest we were just over 300 per 100,000. That's still really high. And a number of people have heard me say this before. When Blackburn with Darwin went into restrictions in the summer, their rate was 50 per 100,000. So the virus is definitely still out there and still being transmitted. We see slightly more women, 51% testing positive as opposed to men. And as I've just mentioned, we've got widespread community transmission across the borough. The highest number of cases are in our 30 to 39 and 50 to 59 age groups. We obviously keep under close scrutiny the cases in our 60 plus age groups, and whilst they've gone up, they're not at the scale that we've seen in the other age groups. The other thing probably is just to mention at this point is that we also report on weekly death data, and for the week ending the 17th of November, we saw 23 deaths reported within 28 days of a positive test for COVID, and we'd seen 19 in the week before. I would anticipate that that number will go up again next week, because unfortunately deaths follow the increases that we see within hospital admissions, and they're usually about a time lag of about 2 weeks. So the hospital is busy but coping, but I do feel that we're going in the right direction. The lockdown measures, the tier 3 restrictions would appear to have definitely made a difference. We've all had to change our lives significantly, but it does feel that if we don't carry on with these same restrictions, we could easily start to see that increase in numbers starting to go back up again. So thank you, Chair. That was an update on the latest data, but as I said, we publish it weekly on Wirral Intelligence.
Yeah. Okay. Yes. Thank you very much for that, Julie. I mean, I know we've had quite detailed discussions tonight about the testing and about contact tracing, but if anyone has got any questions for Julie on the detail that Julie's just explained about the data and the figures, any questions around that? About why we think what's happening is happening? No? Oh, okay. That's fine. Oh, Councillor Cannon, then Councillor Jordan.
Thank you, Julie. I think really it is just looking at the figures and looking at what we would expect in order to try to control this. I mean, what you talked about with the track and trace system and the local track and trace system, hopefully will be the magic key to everything, and we'll actually get sort of the proper information at our own fingertips, and we'll be able to trace people locally. But how do you envisage us coming out of this? I mean, there's been lots of research about 2-week lockdown cycles, how we promote that, and I was just wondering what you think, because at the moment we're getting very little feedback centrally about what's going to happen. So I was wondering what your outlook was locally. Thank you.
I think I'm the Grinch at Christmas at the moment, Councillor Cannon. I think we're going to head into some quite difficult phase. The virus loves being inside. The fact that, obviously, the colder weather, etc. Our figures, whilst they're coming down, they're still high. So I do believe that we'll still have restrictions going forward. I only know what I hear on the TV and through the media as well, that there might be some relaxing for a few days, but I can see us having to be in some form of restriction through until the spring. And until obviously the vaccine has been rolled out and the majority of people have got the vaccine. But I'm afraid that the virus is still there, and it's going to be, and the other challenge for us, I think, that people start to need to think about is this virus isn't going to go away. We're going to have this virus, but hopefully we'll have the vaccine, and we've got all our other measures such as PPE, testing and tracing. That means we can manage it much better. But we're going to be in restrictions for, I believe, for a little while longer, though maybe with a little bit of respite.
Okay, thank you.
Thank you. And then Councillor Jordan.
Thank you, Chair. Julie, what was the current impact anyway, on Arrow Park? Are they still doing electives, or have they abandoned them?
No, they've kept on doing electives all the way through. They were under significant pressure earlier on in October and into November. Sorry, I'm just trying to bring up the report that we've got just to see. So Arrow Park, they particularly, the sort of peak activity was middle of October, 19th of October, 20th of October, when they had 87 people in a bed with a COVID diagnosis. On the 13th, they were down to 60 and 5 people in ITU. So, busy, and it means, obviously they're needing to manage COVID and non-COVID patients, but they've, I don't like to tempt fate, but they're busy but doing okay. I don't know if Graham would want to make any more comments.
So all 5 of those were at level 3, were they?
Sorry, level 3.
Intensive care with ventilatory support?
I presume so.
Right, thank you.
Right. Okay, thank you. Are there any other questions? Can I just ask the first listener to resend the message that she sent me, because it's disappeared? Nothing else? Is that a legacy hand, Mary, or did you need some further clarification? Thank you.
I had my hand up.
Sorry. I'm sorry, Phil. I'm sorry.
Oh, it's me and my fingers. As Julie probably knows, I pore over the medium super output area data every few days. So I'm beginning to feel more optimistic about our situation. There clearly are areas like Tranmere, which had 326.3 per 100,000, or Birkenhead South of 297 per 100,000. But I was looking over our border into places I'd never expect to have a rate like Williston, which is 354, or Little Sutton with 369. But I then looked at Whitby in Elsie Port and found it at 756 last time I looked, or even Bourton and Hoole in Chester with over 690. So Julie was making the point to me the other day that people move around, and the only way I can see these developments in those places to assume that people are moving around, and that's the importance of having a system of test and trace that we can trust, and isolation that people realise the importance of.
Okay. Did you want, was that a comment, Phil, more than a question?
That was a comment, an observation on how now Wirral compares to some neighbouring places when you look at the smaller scale of the data. Thank you, Chair.
Yeah, okay. It's really interesting that, isn't it? Because you get assumptions about places, about what will be high and what won't be, and they're not always correct.
And Councillor, sorry, if I can just come in, the Cheshire West and Chester data, they seem to have followed us. They were quite low for quite some time, and they are now the only area in, I think in Cheshire and Merseyside where the numbers are going up, and they haven't started to come down yet. But yeah. And they, of course, never went into Tier 3 restrictions.
No, they didn't. Councillor McLaughlin.
It's just really to recognise, and I know we do it in various fora, I suppose the word is, from time to time, but the really magnificent work that the public health team and our health partners have done throughout this, and it's good to see the figures coming down, and we recognise that we're not out of the woods, not by any manner of means yet. But thanks very much for you and your team for what you've been doing, Julie, over the last, it's getting to the best part of 9 months now, isn't it? A long time.
Yeah, thank you. Thank you, Councillor.
It absolutely is, and I know it's at the last committee, and it's very, very true, and it continues without any respite, I think is the point. And that's not a short break, that really is respite. That is what you don't get, Julie, but there seems to be something new. Every couple of days, some new assault on the resources of the public health team, but you always seem to manage to meet it. So absolutely, I would echo what Moira said there. It's superb work that's gone on, and I know now this is out in the public domain, but I do keep saying to people, yes, the infection rate's coming down. Can you keep it quiet? Because I have serious concerns that once people think, oh, well, it's all right now, oh, it's all over, it's better now, and that the risks of that happening are really great. So I'm all for keeping this under wraps, the fact that things are improving. Right, anything else on this item? No? Okay, there is an extra urgent item, which isn't on the agenda, but it is an urgent item. Members, I'm sure you'll agree. It is around the budget workshops, and we need to look at the feedback from those budget workshops and just run us through what they are. It's not on the agenda, but we really do need to consider it, because we need to be able to decide what our budget preferred options are, and then send those decisions to Policy and Resources for them to consider. I have seen your hand, Councillor Cannon, but I think Graham is going to just run us quickly through the budget workshops. Thank you, Graham.
Thank you, Chair. So in terms of the budget process overall, the council budget setting process is in the context of a council that's under significant pressure. And whilst the budgets for this particular committee are due to balance this year, the council overall has a significant gap in year due to COVID-19, but also in the future. That does mean that the council's applying for capitalisation of a shortfall in the region of £60 million and work in relation to filling that gap so that we have the ability to bring the budget in line over the next 5 years has been a matter for quite significant and urgent work in advance of a submission to MHCLG requesting that capitalisation. So our workshops have taken place in the context of a medium-term financial plan, as well as the current year budget situation. EFI has forwarded to group leaders information captured at the last workshop, which was the third of our workshops, really exploring in some detail various methods by which we could potentially contribute to reducing the costs around social care, with the aim of having a focus on the effectiveness of outcomes in social care as opposed to cuts. So that information has been brought together, and at our last meeting the chair was stated that today would be an opportunity for elected members to consider the outcome of those workshops and to provide feedback to P&R committee in relation to those items supported or not supported. I hope that's helpful, Chair.
Yeah, thank you very much, Graham. I'm sure that that the most recent workshop was close enough for most of us to still be able to remember what happened at that workshop. Councillor Cannon, you were indicating before.
Sorry, thank you, Chair. Yes, I mean, this is a vital point, isn't it, really, because obviously P&R is slowly coming towards us. And, you know, I've been incredibly impressed about the amount of budget information we've had, certainly in comparison to other committees that I've been in. It's far superior to the others, and I can only congratulate the officers for that, to come in up with and sort of supporting us in our choices. Obviously, we'd previously made a motion to this group, which at the time was rejected. People felt that there wasn't quite enough information. So I've got another motion today, which I will obviously email all, to you. But our motion is that I would like to put to everybody, which is Adult Care and Health Committee wishes to protect services where a reduction in budget would lead to a more costly demand pressure occurring subsequently. Adult care and health services will contribute significantly to savings over the next 5 years by aspiring to delivering its services efficiently to a high standard and in a way that ensures people can be independent for as long as possible. Committee has considered all of the options and wishes to proceed with budget option 2, which was the 500,000 savings from Wirral Evolutions, with all of the discussions that we had around Wirral Evolutions going forward, obviously. We wish to go ahead with budget option 3, which is the strength-based assessment, as well as all of the in-year savings to be reprofiled into 21-22. And for the reasons really stated above, them being the cuts that were impacting on the quality of services will lead to greater costs in future years. So therefore, we would like to reject budget option 1, which was the rationalising of contracts for the voluntary community and faith sector. Budget option 4, which was the discontinuing of paying the real living wage fee to care providers. Budget option 5, which was the reduction of the NHS care providers and social care contracts. And budget option 6, which was the adult social care staffing reduction. And budget option 7, which was the public health staffing reduction. So obviously that seems like a lot of rejection, but as we all know, we've researched, we've thrashed this out, we've talked about the reasons why we've come to reject all of those and for the well-being of our residents. So I so move. Thank you.
Thank you. And could you please put that in the chat for people so that they can actually read it? It's a long motion, so I think expecting people to remember everything that you said probably difficult. So if you can, I'm assuming you've got it there somewhere that you can paste it up in there.
I will do, Chair. I've also emailed that to everybody, including Vicky.
Fine, thank you very much. I've got a hand up from Councillor Usher, which I assume is a hand that's waving goodbye, Councillor Usher, at this point. Councillor Usher? I'm assuming he's gone. I've got a second from Councillor Frost, seconded that motion.
Thank you, Chair.
Councillor McLaughlin.
Thank you very much. I haven't seen the email yet. I will look at it. Listening to it as you go through, there's nothing in there that I would I would challenge. So I'm happy to support that. I think we have put in a significant amount of work. We have had very detailed information coming forward from the director and his staff. There has been a very significant amount of work in achieving savings to this point. And although some of the savings from last year haven't been achieved, that is largely because of the impact of COVID. And there are some really good developments coming forward which will enhance, you make that point, Kate, about enhancing the care that we deliver, that is delivered on our behalf to people who are in need, such as the telecommunications work, the IT work. I have to say, it was brought to my attention tonight, really, how dependent that is for its success on good internet access. And it was Mary not being able to get in and having all the troubles she's had today with her internet access that makes you realise that actually we do need very, very good broadband for people who are going to be using that IT technology to keep them safer at home. And also the extra care housing, which is really moving now and which will improve quality of life and also reduce the dependency on residential care when it is delivered in the kind of numbers that are planned. So I'm happy to not second it, it's been seconded, but certainly I'll be supporting the recommendations that you've made, Kate.
Thank you, Moira.
Right, thank you, Councillor McLaughlin. Councillor Gilchrist.
I've just read them. They do appear feasible. Of course, I'm a member of Policy and Resources and try and wear several hats in several places at once. But what's put forward mentions a 5-year period, which gives us time to adjust and organise the future way of working. I certainly agree with Moira about extra care housing because I've been pushing schemes for that over several years and we need more sites for that. And that could be an investor save scheme. And I recently raised the issue of aids and adaptations. So again, cooperation with other service committees can help improve the whole. The one thing I just want to clarify is, because it involves evolutions, which could be difficult to manage over time, that time scale for that is being worked through with them rather than imposed upon them. So with that caveat, I think this is a package that we can go to P&R with.
Right. Thank you, Councillor Gilchrist. I do understand from the director that discussions are ongoing with evolutions, not only with the team at Evolutions, but also with the families who are involved there. Can you just confirm that, Graham? But I was pretty sure that was what I understood.
I can confirm, Chair, the work with them is ongoing. The savings target is actually an overspend in this case, so there is a pressure to bring back that overspend. So it'll either sit with social care or with Evolutions, either way.
Right, thank you.
Thank you.
Thank you, Graham. Councillor Jordan.
Thank you, Chair. I don't have a problem with that motion at all. I'm quite happy to support it. However, I do have a couple of other things that I would like to talk about. And that is perhaps we can make some savings and some efficiencies from the way we actually pay our invoices, as opposed to, look, I don't want to make cuts in services or anything like that. I want to see the council be efficient and get value for money. So things like no PO, no pay, to me seems totally ridiculous. Having worked in Unilever for a long time, I know that just would never happen. Things like we talked about at the last meeting about adaptations to homes. Again, we need a joined up approach whereby, health aren't paying out the money and housing actually spending it. We need an approach where it all goes with housing or it all goes with health, but it's not split between the two. And we also need to look at what pots of money are lying around, if they are lying around, in things like quality assurance, because we need to be making sure that we get the best value for money for our residents.
Right. Thank you. Are you formalising any of that into a proposal, Councillor Jordan?
Well, I'd like that to be sort of added on to the end, if if that's all right, if Councillor Cannon's happy for that, to look at financial efficiencies, the processes, rather than actually the services.
Yes. Would you accept that if it was about to explore the efficiencies of financial processes?
Yes.
Would you accept that, Councillor Cannon? Yeah. Rather than saying, make efficiencies in finances, because that sounds like you're going to cut out a whole load of money.
Exactly.
Yeah.
No, I want to look at efficiencies in the financial processes.
Financial processes. Okay, that's great. Thank you. Councillor Berry, you did have your hand up. Have you taken it down now? No? Right. No answer. Answer came then, none. I was about to say, Councillor Hodkinson. Graham, yes.
Just a comment really. While I don't disagree with the proposal put forward, I would have liked a little more notice to actually study what was in the content of it. And it's clearly been prepared earlier than the last sort of 20 minutes or so. And I just think that a little more notice would have been the right way to go in order for people to study it a little longer before we actually vote on it or propose and second the item. So that's just a comment that I would like a little bit more notice in the future if this were to happen again. Thank you.
Thank you, Councillor Berry. Graham, got your hand up.
Yeah, apologies, Chair. Again, point of clarification, there are significant additional savings being considered across the whole council in terms of contracts and contractual processes, and I think there's a very strong view that they could be much more effective. In social care, we do have a direct link between the care package and the payment to the providers, so it's very tight in terms of the process for payment. It's quite well developed, but we can always do better. And corporately, there's definitely work to do in terms of those contract processes. So Councillor Jordan raised it, and I do think there's a significant issue for the council as a whole.
Right. Yeah, I think that's right. I don't think it's just us, is it, basically? That's fine. Oh, hang on. Phil wants to add.
I've just taken on board what I said recently about aids and adaptations, and having listened to Councillor Jordan, I'm just suggesting that I move to add that the committee believes steps should be taken that will ensure a more effective operation of the shared aids and adaptation services with a view to a coordinated and improved services.
Right. Well, that's
happy to second that, Councillor Gilchrist.
Right. Thank you. Thank you, Councillor Jordan. I can't think of any objections to that, unless anyone's got any. Speak now, forever hold your peace.
No, not at all.
Right, so you'll accept that, Councillor Cannon, being added in?
Sorry, I was just after clarification. So I'm happy to accept both Councillor Jordan and Councillor Gilchrist as a friendly amendment as for the whole. Is that okay? Or do you want to vote on it separately, Phil?
I'm entirely in the hands of the chair. If the committee's happy to accept it, they're happy to accept it. If they want a separate vote, it's up to the committee.
If Councillor Cannon will take that as a friendly amendment and Councillor Jordan's additions as a friendly amendment, then we end up with a substantive, which has got those two things added to it. Are there any members in the committee who are against this with the amendments? The motion as the substantive motion as amended. Right, in which case then we don't need a roll call for that. We will take that by assent. And I'm really pleased that we can go into P&R now with being able to say this is the unanimous view of the Adults Committee, that this is the budget. We've taken this decision and this is budget that Adults Committee is prepared to accept. So it's very good, I think, for those of us that aren't P&R to be able to go in there with a unanimous decision. So on that note, I do believe that we're done. This is the point at which the processor tells me that we're not. But are we done, Vicky?
Yes, that's correct, Chair. That's the end of the agenda.
Thank you.